Welcome to Digital Mental Health Musings, a podcast series from the eMental Health in Practice initiative, providing health practitioners with the latest news and developments in digital mental health services and resources. MPRAC acknowledges the Turrbal and Yagara people, the traditional custodians of the land on which we bring you this conversation. We acknowledge elders past and present and honour their continuing connection to land, culture and community, and that it's these connections that are intertwined in Indigenous mental health and social and emotional well-being. We acknowledge the strength and resilience of all First Nations people and communities since colonisation of their unceded lands. Hello and welcome back to Digital Mental Health Musings. I'm your host, Dr. Tanya McMahon. And on the program today, I'm chatting with Dr. Louise Farrer. So Dr. Farrer is both a registered psychologist and also a senior research fellow at the Centre for Mental Health Research at the Australian National University. Her work focuses on how technology can be used to improve access to mental health care among people in the community. And she has a long history in digital mental health, having worked on Mood Gym and eCouch, two of Australia's early digital mental health programs. And we actually had an earlier episode chatting to someone from the team at Mood Gym and eCouch, if you're interested in listening. But more recently, Dr. Farrer has been granted an Australian Research Council Award to examine how mental health professionals in Australia integrate digital mental health into their practice. And this is something we look at a lot in MPRAC. So we're really excited to chat to Dr. Farrer. And the data from this work that she's doing will be used to develop guidelines that could optimise the use of digital tools by practitioners in the Australian mental health care system. So we're very excited to hear about that. Lou, thanks so much for joining us and welcome to the program.
Thank you so much for having me.
So Lou, your current research will give us some really valuable insights into health practitioners' attitudes and experiences with digital mental health interventions. Can you tell us more about the study and what drew you to this area of mental health?
Yes, well, for me, I guess working in the digital mental health space has been, a long area of interest and passion for me. It started very, very early in my career. I had some absolutely wonderful mentors in Helen Christensen and Kathy Griffiths, who were the developers of Mood Gym, one of the first e-mental health programs. And, I've long been interested and passionate about the ways that technology can be used to, as you said earlier, increase access to mental health care in the community. But earlier in my career, I spent sort of much of my research attention and focus looking at developing e-mental health programs and then evaluating their effectiveness in different populations. And so done some work previously with Mood Gym and other sorts of programs. And at that stage, the field is really about trying to develop the evidence base for digital mental health programs, about trying to establish, do they work? Who do they work for? In what settings do they work? And then I sort of saw the field kind of evolving, and it was getting to a point in my mind where we had now amassed a great deal of evidence about the effectiveness of these programs. We now knew, had some pretty robust evidence that they worked, but there was now an implementation problem. Why is it that we have this great evidence base for digital mental health programs, and why are they so underused in the community, relative to what we know about, their potential to increase access and how effective they are? Also, why are they underutilized by clinicians? Why is the uptake of these programs in clinical practice so very low? And so that sort of led me to put together sort of a program of research that I was very fortunate to be awarded a fellowship to conduct in 2019, late 2018, 2019. That was really what I wanted to understand was, what is the on-the-ground evidence, the everyday experience of clinicians who are using digital tools in their practice? I want to sort of identify and understand what are the experiences of people who are doing that. And also, on the other side, try and understand what's getting in the way, what's stopping, what do clinicians need to be actually, to be able to effectively use these sorts of tools in their practice. And, for me, it was really about trying to understand what was happening on the ground. And so, yeah, that's really what kind of got me passionate, about this kind of space, is really sort of moving beyond kind of effectiveness and about establishing the evidence base for these programs, and now trying to figure out, how do we address this implementation problem?
So you really started at the inception of this area, the establishment of this area, where these programs were just starting to arise and starting to become an option for increasing access, equitable access to mental health care. I know Mood Gym was pretty much one of the earliest, if not the earliest, digital mental health intervention out there. So you were there right from the inception, and have taken this, it sounds like this really interesting journey through building the evidence and figuring out, yes, these things can actually work. And then on to the problem that we're all dealing with now, which is, well, how do we implement them into clinical practice? How are they integrated? So that's a really fascinating journey. It sounds like you've got some really interesting insights from being there from the start. So you started this project early in 2019, and then of course COVID-19 hit. We all had to move very rapidly to some kind of digital mental health. For many of us in those early days, it was telehealth. How has the pandemic actually impacted your research?
Yes, well, so as it turned out, I was awarded my fellowship in late 2018 and I started in early 2019. Then I actually went on leave for a year. So I paused my fellowship for a year and I went on leave. So I wasn't actually conducting any research throughout 2019. But as fate would have it, which was very, very interesting timing, right when I came back to work in March 2020 was right when the first lockdowns of the pandemic hit. And so the focus of my fellowship was not actually specifically about telehealth. It was about digital programs generally. So I was interested in how clinicians were using any kind of technology in their practice. But it soon struck me that as this transition to telehealth was happening very rapidly and very much in real time, that we really needed to understand what was happening. We needed to understand how this was evolving on the ground, what were clinicians doing to make this really unprecedented adjustment, right? I mean, prior to the pandemic hitting, uptake of telehealth was there. Obviously, it has existed for a very long time, but such a small proportion of clinicians were using it in their practice. And we've never seen a shift like that in history for a bulk of the psychology workforce to now move online. And if you cast your mind back, for many people that happened over a weekend. It was almost like Friday night, clinicians were finishing their practice face to face. And on Monday morning, they were all online. And that is, if you think about it, an incredible adjustment for many clinicians who may have never used technology before in their practice whatsoever. So as this was kind of unfolding, I thought, I've got to get my skates on here. I've really got to understand and put together a project that can try and track. I was interested primarily in how clinicians were doing telehealth. How did they make that transition logistically? And also, how were their attitudes towards telehealth changing and evolving? Because what previous research has told us is that, a large barrier for many clinicians in engaging with digital tools, and particularly telehealth, have been attitudinal. So it's been things like their attitudes, their concerns or worries about it, maybe their lack of familiarity with using telehealth in particular. And so I was really curious to try and understand that. And so that's what happened. And so what I essentially developed was a quantitative survey that looked at the logistics of telehealth use and also attitudes about telehealth, and also what clinicians' needs were now that they were engaging in clinical work in a new way. What were their wants and needs with regard to telehealth use moving forward? And then I also developed a qualitative arm of that study as well, and then did some in-depth interviews with clinicians as well to try and understand what their sort of more in-depth experiences of using telehealth were. So that study, by the time I got it up and running, the data collection for that study happened from about May until July of 2020. So it was a little bit after the start of that sort of lockdown in March, but it was still kind of happening at the time of when that big transition was happening.
So a very big pivot in your
big
research.
Pivot, yes. I wasn't intending to look at telehealth at all, but that's research, right? Isn't it? Because you have to be responsive to what's happening around you. So it's been a fascinating kind of pivot and transition in my work, and it's been something that's been really quite interesting to examine.
Yeah, and I imagine too there must be some overlap as well, because as you're talking about the really huge and sudden adjustment to telehealth that we all experienced, myself included. I remember that week.
Yes.
It was a hard week. I sense that we're all experiencing a similar, not as sudden a shift, but also a similar really big transition to integrating digital mental health. Obviously, with the mental health crisis, a huge amount of demand that's out there. Obviously, it's eased a bit since the pandemic, but there's still huge demand and unmet need, and people are looking for ways to solve that. And digital mental health is a clear one, but it's just a huge hurdle to overcome for clinicians. So imagine there's a lot of parallels there with, you know, a big transitions to these new digital technologies to enhance our work essentially, but yeah, massive hurdles to overcome.
Absolutely.
And you've said previously that health professionals are the gatekeepers of digital mental health. Can you tell us a bit more about that and what your research has revealed about the kinds of factors that influence when there is higher practitioner engagement in digital mental health?
Yes, absolutely. And so I think, it's helpful to kind of think about, obviously there's a huge variety of digital mental health tools and programs available, and there are, many digital tools, apps, programs, things like that are available direct to the user, right? They're sort of community-based tools, self-help tools that people can sort of jump online and they can use, without the involvement of a clinician or anything like that. But within clinical practice, the use of technology, in a blended model or as an adjunct to face-to-face care, or, in the case of telehealth as sort of the primary mode of delivery, in that realm, clinicians are incredibly important gatekeepers of digital mental health. And I suppose what I mean by that is that they every day are making critical decisions about the usefulness or the utility of digital tools. They're making decisions about the appropriateness of digital tools for different clients. And so there's a lot of power in that, because if we think that digital tools are designed to increase accessibility and to remove sort of equity barriers and things like that, if clinicians are making decisions and saying, well, I think digital tools or telehealth or whatever is going to be useful for this client group, but not for this client group, or useful for this client or not that client, I think that raises some really interesting questions about, the usefulness of these tools in terms of their ability to, to meet that demand that you were talking about and to meet that, that level of need. The other way I like to think about clinicians being gatekeepers is that clinician attitudes towards digital tools and the use of digital mental health programs has such a profound influence on the attitudes of the clients. So when people engage with digital tools, if they're working with a clinician who thinks these tools are fantastic, who integrates them masterfully in their clinical practice and utilizes them to their full capacity, and uses them in the sort of the really powerful and clever ways that they were designed to be used, I'm speaking a bit anecdotally here from my own clinical experience, but also from in the qualitative work that I conducted with clinicians. It was quite clear to me that when a clinician had a really positive attitude towards digital mental health, the clients they worked with saw the power and the value of those tools as well. Conversely, when you have clinicians who might be, a little more reluctant or a bit more hesitant about digital tools, or who certainly hold views that, for example, they're not as effective as face-to-face interaction, or you don't get as quality, as good a quality relationship with somebody if you're working through a digital medium as opposed to a face-to-face kind of medium. You can see that gets picked up by their clients as well. So the people that they're working with also might tend to develop some of those attitudes that technology might be a bit of a second class or a second rate way of engaging with somebody, compared to kind of the real way that we do therapy, which is face to face in a room. And so I'm really interested to understand the interrelationship between those things, because obviously the uptake of digital mental health programs in clinical practice is going to be heavily influenced by the attitudes that clinicians hold about those tools, and also the capacity they have in their workplaces and the support and the culture, I suppose, that sits around the use of those tools. Yeah, so that's kind of, I guess, what I sort of mean when I sort of talk about them as being really important gatekeepers.
And that's really interesting, the point you make about the attitude of the clinician having such a profound impact on whether the client then engages with the tools as well. That's definitely been my experience as well. And interestingly too, same with telehealth. I remember at the very start, the switch to telehealth, when there was a lot of skepticism about, well, is this still real therapy? Or, is this, this is just like second-rate therapy.
Yes.
And people were very hesitant about engaging with that, and that may have impacted on their journey and their outcomes because of the medium. But as soon as we built confidence in it, and my attitude and other clinicians' attitudes changed, this is just how we do therapy, and people had seen it work, then the experience for the clients changed quite dramatically. I think the same, it definitely goes for digital mental health, where if clinicians view it as this, oh, I guess there's this thing out there, I guess you could try this app, or, this might help, maybe give it a go. It really doesn't build a lot of confidence in the client that this is something helpful. Whereas if clinicians treat it as part of treatment as usual, this is just what we do, this works, and have that really strong belief in its efficacy, it definitely, anecdotally anyway, has a much more positive impact on the therapy.
Yeah, that's right. And I mean, the evidence base supports that, right? So, if clinicians, I know that's a lot of the work that MPRAC does is really about, sort of like improving awareness and creating that understanding of the evidence base for digital mental health tools among clinician populations, because, them understanding that actually these tools do work, they do have a really good evidence base. But I think for a lot of clinicians too, they need that lived experience of it working. At least a lot of the clinicians I talk to, naturally, they were going to feel skeptical, never having worked in this medium before, particularly when it came to telehealth. But almost once that Band-Aid was ripped off, and once they were could get more and more experience under their belt of it working and being effective and being useful, it's a game changer. It's almost like, that sort of, familiarity sort of breeds positive attitudes, that ongoing experience and that comfort that clinicians can gain just through doing, through that sort of that lived experience of doing it, is really powerful, and I think has gone a long way to normalize digital mental health tools in clinical practice, much more so than before the pandemic. So yeah.
Absolutely. And that's really been a standout message that we've had with previous guests. We chatted with a GP from Black Dog Institute, and we both agreed that having even just one powerful positive experience with the new technology, whether that's telehealth, but, in terms of MPRAC's focus, digital mental health, having that one positive experience of it working and being familiar with it can go such a long way to building that confidence in a clinician that, oh, this works and it actually wasn't that hard. And this is quite amazing, in fact.
Yes.
Yeah.
Yep.
And in terms of practitioners' current attitudes, that you looked at it in your own research, what have the prevailing attitudes and perceptions of digital mental health been so far among the health professionals that have participated in your research?
Yeah, really interesting. So we had a lot of really quite fascinating findings actually from this study that we did about that transition to telehealth. And what we found is that, I guess, first of all, the survey was conducted sort of from May to July back in 2020. And so we looked at, sort of how people were using telehealth, what platforms they were using, what percentage of clients they were using telehealth with and things like that. But really interestingly is that we also looked at factors that predicted how many clients clinicians were using telehealth with. So there were some in our sample who were using telehealth with 100% of their clients. Many of the clinicians in our sample were sort of doing a combination of face-to-face and telehealth work. And what was really interesting is that propensity to use telehealth. So the clinicians who were using telehealth more, that wasn't predicted in our study, at least, by factors like whether they'd used it before, whether they'd received training in it before, or any demographic factors. None of those things actually were related to whether people were using telehealth lots. It was actually, interestingly, their level of comfort with using technology, and it was their level of positive attitudes that they had towards it. So those were the two biggest predictors. So, it's interesting because we think about clinicians and we think, oh, let's give, them sort of training in how to use telehealth, or let's, trying to think of other sorts of examples. There might be, particular other sort of characteristics of clinicians. Those things are really, really important because competency in telehealth is really important, and competency in use of digital tools. But interestingly, in our study, it was those attitudinal markers that were really powerful in predicting clinicians' willingness to engage with at least telehealth in our study. What was also an interesting finding in our study was that we asked people, how did you feel about telehealth when it was first introduced in March, and how do you feel about it now that you're filling the survey in May? This was from May to July, so between sort of 2 and 4 months later. And interestingly, positive attitudes increased over that time. And so that kind of goes back to that point I was saying before about familiarity seemed to breed an increase in positive attitudes towards telehealth, at least over that time. So the other thing that was really kind of interesting is that there was, of course, some quite unsurprising concerns that emerged from my research. So the top sort of concerns that clinicians had about using telehealth were some of the things that we kind of know already that have come out previously in the research. And there were things like, the reliability of technology, concerns about privacy and safety of using telehealth with particular client groups, some concerns about the impact on the therapeutic relationship. So if you're working via telehealth, are there any impacts? Is it the same quality of the relationship that you would, get with somebody working face to face? So these were sort of, consistent sort of concerns that were coming up in my study too. But the other things that came out, levels of exhaustion. So clinicians reported being much more exhausted working via telehealth than they did kind of previously. Again, what would be really interesting to note is how much now what we found back in 2020 has changed compared to now. What would actually be really fascinating is to look at how clinicians are experiencing telehealth now compared to how they experienced it in 2020. So I was talking to a colleague the other day, and she resonated with that very much. She said, yes, I did feel, quite exhausted back in 2020 when telehealth was first introduced. But she says now it's such a normal way of working for me. I don't experience any kind of difference. So that's kind of interesting. And finally, I guess some of the other questions we asked in this survey was that we asked people to agree with a range of different sort of statements about attitudes about using telehealth. So the statements were things like, I deliver just as good a service via telehealth as I do face-to-face. It's easy to assess my client's emotional state using telehealth. Telehealth is appropriate for all types of clients. There's a whole 22 sort of items altogether in there. And what was really interesting to come out of that is that it was sort of a reasonably sort of even split between people who thought that, telehealth was kind of good for assessing or okay for assessing emotional state versus having difficulties being able to assess the emotional state of their clients. What came through quite strongly is that, at least in my sample in this study, the clinicians didn't think that telehealth was appropriate for everyone. They did quite strongly indicate that there were some client groups, and this was mainly along the lines of clients that they thought may have more complex presentations, or clients who may have, a particular, sort of backgrounds like trauma backgrounds or other sorts of backgrounds where they felt as though telehealth may not be an appropriate medium to work clinically with them with. And so I'm really curious to know, has that changed and shifted over time now that we have more experience using this modality? But I think there's still a lot of unanswered questions. There's a lot of work I think that still needs to be done to try and understand now what the experience of clinicians is using telehealth compared to what it was like back in 2020. So yeah, quite a lot of interesting findings. That work has now been published. So there are many other sort of findings in that study if you're interested to know them as well. But those were sort of the major ones that stood out for me.
All really interesting, and again, a lot of parallels to the kinds of attitudes and concerns as well that clinicians have when it comes to digital mental health, with privacy and efficacy.
Yeah.
And is it going to be suitable for all my clients? A lot of people think no. There's certain client groups that it's not going to be suitable for. So it sounds like it's really speaking to this larger, maybe philosophical issue of, where does technology fit in the therapy space, and where does it fit and where doesn't it fit, and how can it make our job better, make our work better. And on this podcast we do talk a lot about different models of blended care, different ways of integrating technology and digital mental health interventions in particular into care. For example, whether that be using digital mental health in sessions or to work on it between sessions to kind of extend the therapeutic hour. What kinds of trends have you seen emerge about the ways in which practitioners are actually integrating digital mental health in practice?
Yeah, great question. So I suppose from that study I did back in 2020, we were looking primarily just at telehealth use. And a part of that, so I sort of couldn't speak more broadly about, how clinicians might use other sorts of digital tools in their practice. But an element of that study that we did was after that initial survey that we did that I spoke about the results of earlier, we actually followed a subset of that sample and we surveyed them again two monthly intervals after that initial survey. So we surveyed them again sort of 2 months later, 2 months after that, and 2 months after that. And at that time, we were really wanting to understand what their propensity for future use of telehealth was going to be. So at that stage, as you might remember, restrictions were easing, face-to-face work was becoming more kind of resuming in some capacity. And so I was really curious to understand, are things going to go back to normal? Are people going to sort of ditch this telehealth thing now that we can go back face to face? And can we, are things going to sort of go back to what they were pre-pandemic? And what was really clear was a strong appetite for the continuation of telehealth. And what my research said was not in its entirety. So clinicians were very clearly saying, I don't want to. Some clinicians do. Once they had used telehealth, they thought, well, I'm only going to work on telehealth now. I'm not going to do face-to-face clients anymore. But the majority of the sample, at least in my study, had a strong appetite for hybrid working. So they really, and in the future, they loved the idea of being able to do work in some capacity face-to-face, in some capacity in telehealth. And so that's kind of a really nice, another blended model, right? It's this idea of being able to say, okay, well, how can I incorporate technology into my practice using telehealth? And this was very much along the lines of suitability for the clinicians. So the clinicians were reporting lots of really obvious benefits of using telehealth. They were saying it's more convenient. I don't have a commute. I can work from home. I, can keep therapy going if I'm sick or my client's sick or, we have a sniffle or something like that. But also being able to meet the needs of clients too, because some clients were having preferences to engage via telehealth, particularly those who might be time poor, who might have had difficulty, accessing a clinic face to face. And so there was a really clear and strong appetite to be able to to fit those things together into clinical practice to be able to meet the needs of both clinicians and clients as well. And so I guess that's what came out quite strongly, that element of choice and that hybrid approach of telehealth and face-to-face.
Oh, what a wonderful thing to discover. It's like this, the accident of the pandemic happened. We were kind of forced to embrace this because we had to. And then the real test was afterwards, when we were, had the freedom to go back to face-to-face work. Are we just going to go back to business as usual pre-pandemic? And by then, everyone had seen the benefits to the clinician and the clients of using telehealth. And I wonder if we will see the same with digital mental health interventions, where when we have to kind of rely on them and start using them more, because there's just simply not enough clinicians to see all the people who have mental health needs in this country, in the world even, is using it going to really lay out to us, well, there's actual benefits here, to us and to the clients, that we wouldn't really want to go back to an old way of working once we discover them.
Absolutely. I think you're right. It really can't be understated how much the pandemic and the need to switch into digital modes of mental health care delivery and healthcare delivery generally has changed everything. It's changed everything. Like, it really has. If you think about, we could never have imagined this level of uptake of telehealth, prior to the pandemic as it is now. And I really understand what you're saying there, is that I think it remains to be seen what the ongoing impacts of that attitudinal shift in the community and in the health professional community as well, that swing or that shift, how that's going to then ripple out and affect people's attitudes towards and uptake of digital mental health tools broadly. I think it's a really, really interesting question, and something that I think we'll need to keep our finger on the pulse of as time goes on. So it's a really fascinating question.
Certainly. One of your areas of interest is exploring different methods, different ways to support users of digital interventions, and examining the factors that predict response and adherence, whether people really stick with them. I wonder, are there any insights at this stage about the kinds of strategies that might improve greater uptake and integration of these tools into practice at that more systemic level?
That's a great question. I just going back to what you were saying before, my sort of my work in the space around, adherence to these programs and sort of supporting users of these programs and predicting sort of uptake and adherence has been, the work that I've done in that area has been less in the clinician space and much more in sort of the direct user space. And so when we have sort of users of digital mental health programs, the end users, I suppose, not the clinicians necessarily. Some work I've done previously has looked at, well, if you have a coach or you have a clinician, or if you have somebody who's actually helping you use a digital mental health program, does that help you stick to it better? Does that help you complete the program and get sort of the maximum therapeutic benefit out of it? I've also previously been interested in looking at, are there particular demographic or psychosocial or other sorts of predictors that might give us some clues about who in the community might be more likely to engage with digital mental health programs, or who might, because they're as powerful tools as they are and amazing as they are, we also know that they're not necessarily for everybody, in the same way that any kind of intervention or treatment or approach is not going to be suitable for everybody. And so it just is sort of about matching, and thinking about how we match those sorts of things. But with regard to clinicians, it's a really interesting question. And so the next phase of my research will actually be focusing on this particular issue. So I don't have a clear sense of what that is at the moment, but a lot of my research in this space, particularly because it has an implementation science focus, is really looking at using frameworks for understanding the factors that optimize implementation, or the factors that actually improve implementation or engagement with digital tools. And one of those frameworks is normalization process theory. And so that's certainly been used by a range of different digital mental health researchers to try and understand what are the factors, or what are the influences, or what are the things that we need to change or improve to assist clinicians to use digital mental health tools better or more in their practice. And so in my mind, they sort of exist at various different levels. Obviously, they sort of exist at the level of the individual, and those are things that we can affect by, helping to shift clinician attitudes about digital mental health programs, improve their understanding of the evidence of how they work, give them opportunities for lived experience to see them working and feel them working in practice. At sort of the interpersonal level, or at the level of the organisation, I think it's also really important to have really a strong culture around the use of digital mental health tools. Obviously, that's going to be different for private practitioners who maybe work, or people who might maybe work as sort of sole clinicians, or they're sort of working kind of by themselves in their own practice. But it's the same concept still applies. Surrounding yourself with peers, colleagues, and even sort of managers or bosses that also use digital mental health tools, who support and enable your practice and create that kind of community of practice, I suppose, around use of these tools, is going to make it easier, to use those tools in your practice and take them up, compared to if you're just that person by yourself in your organization trying to use digital tools in your practice, but nobody else around you does it and they don't really like it very much. And you sort of feel like you're going out on, a limb by yourself to use these tools. So those sorts of things are really powerful as well. And then, of course, there's influences at sort of the government policy level, and so broader systemic issues that support regulation and safety and Medicare support for, use of digital tools, and our training systems. How are we training new clinicians to use digital tools in their practice? What are our educational and training systems doing in this space as well? So in my mind, it operates at many kind of interrelated levels, which is why it's a complex thing to shift. So I don't know if I have the answers, but those are sort of all of the levels at which I see it operating. And so going back to what I said at the start, my next phase of my research is to really, I'll be doing some field work, which involves kind of embedding myself with clinicians, and this will be clinicians working in services, but also clinicians who might be working privately or in other sorts of settings as well, to really be a bit of a fly on the wall, sort of an observer, and to talk to them, their colleagues, and get a really holistic understanding of best practice, how it's working on the ground, what the barriers are, what the drivers and facilitators are, and to try and understand that by kind of seeing it in action and sort of being there and getting a really in-depth sense of how clinicians are using digital tools in their practice. And so that's why I'm sort of putting a bit of a call out to clinicians who are using these tools in their practice, and they think they might be, you don't have to feel like you're doing it perfectly or doing it really well, but if you have sort of, been involved in a process about integrating these tools into your practice, I'm really keen to learn more and to study that and to try and understand what the factors have been in determining that and how it's worked.
Fantastic. Well, I will add those details into the show notes about that call out for clinicians, because that's exactly what's happening. There's a lot of clinicians out there who are just feeling their way, finding their way through the
Yeah.
space and just making it up as they go, and finding ways for this to work, finding ways that it doesn't
Yes.
work.
Yep.
So there's a really, it's a rich source of material out there in terms of discovering how clinicians have tried to make this work in the absence of much to guide them.
Exactly. And I'm sort of really keen to gather the evidence and to understand it from the ground up. I want to sort of understand how clinicians are working on the ground. What are they doing? What are the gaps? What are the successes? What's working well? Like you said, how have they actually navigated this and how are they doing it? And, to then try and kind of feed that up into some sort of broader work that can help kind of guide people in their use of these tools, or sort of guide this space a little bit. I think it needs to be, I'm really interested in it being driven from the ground up, from clinicians who are doing the work, who are actually sort of engaging in it themselves.
Yes. Yeah. And Lou, I mentioned in the intro that some of your early work was actually with some of the really early digital interventions, MoodGym and eCouch. With that background, I'm actually interested to hear your thoughts, just pulling the lens back a bit, about how the digital landscape in mental health has actually changed over the last decade and even since COVID-19, because I think part of the challenge with integrating these tools the clinicians on the ground are experiencing is that there's just been a huge proliferation in digital tools since those early programs. We're not just talking about, here's 10 great programs and here's how we're talking about dozens, scores, even hundreds of different tools since those early programs were introduced. Do you think that the promise of digital mental health, particularly that promise of greater and more equitable access to care, has been fully realized?
Yeah, that's a great question. No, I don't think it's been fully realized. I think there's still that, the field has made enormous strides forward, like we talked about with the pandemic. And I think it was interesting the term you used, like a happy accident kind of thing. Like it kind of actually was, like, and I don't mean that in a way that meant, obviously the pandemic was such an awful time for everybody and still is for the community. In terms of engagement with digital mental health programs, it's really changed, I think, how both the community and the clinical sort of health professional community view these tools and view the utility of these tools. I think it's really moved them from being what may have been considered, the alternative, like an alternative way of engaging or an alternative forms of treatment, into something that are more mainstream, legitimate ways of engaging with healthcare, which is such an amazing stride forward in terms of implementation, right? To attitudinally move from these things being kind of like, yeah, they're an add-on, or they're just sort of, they're not the mainstream. They're not how we do business. They're not how we do things. They're actually now, I think, much more accepted as being things that are, sit beside, essentially what previously was considered our mainstream forms of care, which was sort of that face-to-face modality. I think something I'm very curious about, and this is also something that where sort of some future areas of research that I'm growing at the moment and developing, is to look at the idea of digital exclusion and digital equity. Because while digital mental health programs were designed to really sort of increase the accessibility of mental health care, and they certainly do for many people, they cross sort of distance barriers, cost barriers, all of those sorts of great benefits that we know that digital mental health tools have. And I know I said earlier that, no treatment or no sort of approach is appropriate for everybody, but I've been reflecting recently about, when we have these major community shocks like pandemics, where most, if not all of our healthcare has to be delivered through digital means, the question I have is, are there certain groups in our community who may be at heightened risk of needing mental health care or needing sort of mental health intervention, who may also experience difficulty engaging with digital tools? And so how, as clinicians, can we assist those client groups to be able to engage with technology, if that may be one of the only modalities through which they can access mental health care, and ensure that we don't inadvertently exclude people who are already at great risk of digital exclusion, if you know what I mean? There are some groups in the community that we know have difficulty accessing technology for many different reasons. And so I'm really curious to understand this question of digital inequity, and that's sort of a research projects that I'm developing at the moment around this space. And so I don't know if that's the case. It's just a bit of a hypothesis at the moment. And it was a little bit driven by this previous work with clinicians, actually, the survey that I did, because the attitude that clinicians were saying or holding around the suitability of telehealth, for example, with certain client groups and others, really got me thinking about, well, if clinicians are making decisions about use of telehealth with certain groups, what does that mean for those groups? And are we providing alternative models of care for those groups? But if those alternative models aren't available for some reason or aren't accessible, are we further disadvantaging or excluding certain groups? And so just a curiosity I have. I don't know if it is, and I'm curious to find out more, and I'd like to sort of grow and study this area a little bit moving forward.
It is a really interesting question that, obviously digital bridges a big gap that we all know is there, but is there still a gap there? There's still a gap that vulnerable groups are falling through? Does it really fully address the problem of equitable access? I think that's a really fascinating question to look at.
Yeah. And can clinicians play a role in this? I met someone who, through this study that I did, a clinician who was just an absolutely fascinating, really, really skilled clinician in telehealth and digital tools. And she was saying that she believes that access to mental health care through telehealth or through technology, it should be considered a basic human right. It's something that we actually, as clinicians, if we're finding that certain groups or certain client groups are having difficulty engaging with technology, it's not, the response that we should have to that is not, well, they're obviously not suitable for it. Our response as clinicians should be, how do we bridge that gap and how do we make it approachable, suitable, accessible for our clients? And so she had this really, really, quite driven and quite inspiring approach to it, where she felt it's our job as clinicians to make it accessible for everybody. It's not always going to be, but we now need to work harder. We need to bridge that gap. We need to help our clients engage with this and not hold the view that, oh, well, maybe those clients, maybe this isn't for them. Maybe they can't engage or shouldn't engage with telehealth. It's not appropriate for them.
They're not suitable. Really, or putting the onus on them to make the change or make themselves suitable, that it's actually up to us to mold it around them so that they get the access and the care that they need. It's a great way of looking at it. And I wanted to come back to as well to your research and what you plan to do with the findings. I know you said you want to really work from the ground up. And I understand that you plan to use those findings to develop, ultimately develop guidelines, which makes me very excited. Guidelines to optimize the use of digital tools by practitioners. Are you able to give us some insight into what that might look like or involve?
Yeah, look, I think I may have promised with guidelines, overpromised with guidelines. I think I've written that somewhere, and I think what the actual intention is with the research going forward is that I'll be developing what's called a consensus statement. And so rather than it being kind of direct, actionable guidelines that people can follow that say, do this, do that, do this, do that, instead, what I'm looking to develop is a consensus statement. And so what that is really about bringing together all of the evidence that I've collected in my studies so far. And it's about then sitting down and presenting that evidence to a highly qualified team of experts, so digital mental health service providers, clinicians, consumers, so people who are engaging with these sorts of tools as well, policymakers, digital industry partners, researchers in the digital mental health space. So bringing all of those kind of key experts that have a stake in this area together, presenting my findings to them. And then it's really about pulling together and discussing, now that we understand kind of here's, sort of what the evidence currently is saying, at least from what I've sort of collected. Oh, and also integrating broader evidence. So what sort of international standards or guidelines are, what international standards or national standards or guidelines are that exist in Australia, combining that with the evidence that I've gathered as well, and to put together a document essentially that can be used to inform policy in this area, or that can be used to inform guidelines for practice. So I suppose I think about it as like a step before that, if that makes sense. So it really be used as a bit of a guiding tool, or something that is a sort of a concise kind of piece of evidence that talks about what the areas of success or success in practice are, what's working well, what's needed, and what's needed at all of those levels that I spoke about, sort of individual, service level, kind of broader government policy sort of wider systemic level as well. And really just pulling all of that information together into one place to help try and guide some change, or guide, what the next steps are or what might be needed. So that's the eventual aim with all of this, to assist, I guess, in advocacy as well, in this area and this space as well, and for it to be driven largely by what clinicians are telling us on the ground who are doing the work. So that's sort of the basis of it.
Excellent. Well, we're really excited to hear about how you go and what those findings end up looking like. What's next for you in terms of your research?
Yeah, so my next focus will really be, now that I've done the sort of this quantitative survey, and I've got some longitudinal data from that survey that I'm still yet to analyse and publish. I also have a qualitative component of that study where I conducted interviews with around 34 clinicians. Got a very rich data set there in terms of their experience of transitioning to telehealth during the pandemic. From here, as I mentioned before, I'm really going to get stuck into doing some more in-depth field work. So that's sort of, taking some critical kind of case examples and going and embedding myself in these services and with these clinicians to understand how they're doing digital mental health work on the ground, and really trying to capture and understand that in a really high level of detail. I'll also be reviewing and sort of critically analysing what sort of implementation guidelines exist in terms of Australia and internationally for digital mental health tools. So I'll be pulling that information together and hopefully writing that up into a publication. Finally, next year will really be around pulling together this consensus statement. So preparing and presenting all of this data to that group that I mentioned before, and pulling together this consensus statement on sort of the use of digital mental health tools in practice. And then I'd like to get started on some of that work I was talking about in the digital equity space. So really starting to understand sort of digital equity and digital inequity, and whether that is, occurring, is it actually happening or not? And how do we know, and how might we identify some strategies to be able to, ensure that that isn't happening? So, yeah.
Excellent. All very exciting. Well, Lou, it's been an absolute pleasure talking to you. For any of our listeners who would like to get in touch with Lou about participating in her study, any clinicians who are using digital tools in practice, and like Lou said, not necessarily perfectly or well, just having a go at using them, we'll leave those details about how to get in touch with her in our show notes. And we really look forward to hearing more about the final report from the study. Until then, Lou, thanks so much for joining us.
Thank you. It's been so fun and such a pleasure. Thanks for having me.